I hear it all the time. I don't believe in chi. I don't believe in magical energy flowing through invisible channels. You know what? That is okay. Because as a doctor of acupuncture, I don't treat magic. I treat physiology. Today, I'm going to translate the ancient concept of chi into language your doctor, your physical therapist, and your nervous system understands. But chi not as a mystical mist, but as communication and resources. In Western medicine, we know that for a muscle to move, a nerve must send a signal. Signal is electricity. That is energy. We know that for tissue to heal, it needs oxygen and nutrients delivered by blood. That is energy. When TCM says chi flow, we are often describing the efficient transmission of nerve signals, blood flow, and lymphatic drainage through the fascial planes of the body. Let's look at a real-world example. In TCM, we have a channel called the daimai, or the belt vessel. It circles the waist. If I tell a patient they have daimai stagnation, they might roll their eyes. But if I use my background in biomechanics, I tell them this. Your external obliques and transverse abdominis are tight. They are locked short. When these muscles are tight, they pull on your rib cage. As the body is a kinetic chain, that pull drags your shoulders forward and misaligns your neck. Suddenly, you have chronic neck pain and headaches. Not unblocking a magical river, I am releasing a fascial restriction in the abdomen that is creating a biomechanical dysfunction in your neck. The ancient term is stagnation. The modern term is myofascial restriction affecting proprioception. The treatment? The same. What about stress? We talk about liver qi stagnation. It sounds abstract. But let's look at the autonomic nervous system. When you are stressed, you enter fight or flight, a sympathetic state. Your blood vessels constrict, your digestion stops, your shoulders hike up toward your ears, and your mood becomes irritable. In TCM, we call this liver qi stagnation invading the spleen and stomach. Acupuncture acts as a signaling mechanism. It flips the switch from fight or flight to rest and digest. We aren't moving magic. We are biohacking your nervous system to lower cortisol and reduce inflammation. Finally, let's look at chronic injuries. In TCM, we say there is a lack of qi and blood. In Western terms, we see ischemia, a lack of fresh blood supply, and fibrosis or scar tissue. If an injured muscle can't fire properly, the muscles next to it, the adjacent links in the chain, have to work double time. They get tight and overworked. This is a compensatory pattern. By placing needles in specific points, we trigger a micro-inflammatory response. The brain says, hey, pay attention to this area, and floods it with blood, white blood cells, and healing factors. We are manually overriding the body's neglect of an old injury. This medicine is thousands of years old. The ancients didn't have words for proprioception, vasodilation, or fascia, so they used words like wind, chi, and blood. Don't let the language fool you. This isn't fantasy. It's functional anatomy. Whether you call it moving chi or restoring biomechanical homeostasis, the result is the same. A body that creates less pain and performs better. I'm Dr. Guerrero. If you want to understand what your body is trying to tell you, let's talk.